And Maryland is steadily recovering from the recent Omicron surge, but now that things are calming down, many are wondering if there's another surge just waiting to happen. WDVM's Roshan Davis attended a briefing with two officials from Johns Hopkins to talk about where the state currently stands and what residents may be able to expect.
Just as Maryland's 30-day state of emergency came to an end, reports started swirling about COVID's subvariants, which are potentially more transmissible than Omicron. While researchers fully expect more variants to pop up in the coming months and years, some say the virus can't continue getting more infectious indefinitely.
It eventually will put itself in a pigeonhole where it won't have much ability to change to drastically get around the immune responses. And that will be the time when we can really start talking about this as something more like seasonal flu.
Governor Larry Hogan credited Marylanders for making it through the most recent surge during Wednesday's State of the State address, saying that we have to learn to live with the virus instead of living in fear of it.
Of course, we'll continue to follow the data and the science, and we'll keep fighting back with everything we've got. But make no mistake about it, we are moving forward, full speed ahead, and we will continue to lead the nation in both health and economic recovery.
Even with the end of the state of emergency, Hogan pledged to leave measures like mass testing sites and increased hospital capacity in place. Crystal Watson of Johns Hopkins approved of this decision, but also disagreed with Hogan on his approach to mask mandates, which he's been hesitant to reinstate.
I think while we're in this very high transmission zone, it's important to have those tests available and also to have interventions like masking mandates or recommendations in place.
But when will a return to normal be possible? Vaccine manufacturers are working on recipes that will stand up to future variants. Prakash says that's a difficult process, but we're in a more informed place now than a year ago.
When the vaccines first rolled out, most of us had no antibodies to SARS-CoV-2. Now there's a lot of people with vaccination histories, with infection histories, and we're now trying to find ways to fine-tune those responses with new vaccines.
The experts say there's no way to make definite predictions about this virus, and residents should continue to protect themselves and practice safe habits. Reporting in the control room, I'm Roshan Davis for WDVM 25.